Welcome to this week's edition of the Medical Center Show. We have a great show today. We have a brand new young doctor who's joined our staff, and we're going to talk about sports medicine. We'll be right back.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Welcome back to the Medical Center Show. Today we have with us Dr. Lomas, who heads up the sports medicine program at Jersey City Medical Center. Dr. Lomas, tell us a little bit about yourself.
Hi, Joe. It was a pleasure to be here. So I am a sports medicine specialist. I'm an orthopedic surgeon.
So first you went and got orthopedic, you went through an orthopedic residency.
Exactly. So yeah, just to tell you a little bit about my training,
Sure.
I went to university at Yale University,
Okay.
and I got a biomedical engineering
Wow,
degree
so you're
there.
like an Ivy League kind of guy, huh?
An Ivy League kind of guy.
Okay, that's great.
I even rode in college.
Really?
So it's-
Okay, there you go. So you did
all
all
the
that.
stereotypes, yeah. And then I did medical school at Columbia
Okay.
University in New York,
All right.
and I stayed there for residency. So I did
Wow.
a 5-year residency there
Okay.
in orthopedic surgery.
Right.
And then I did a sports medicine fellowship for a year in Los Angeles.
Oh, okay.
And there I helped to take care of a lot of the professional sports teams.
Okay.
The Los Angeles Lakers actually won the World Championship there in 2009.
And you were part of that team doctor that took
Exactly,
care of them?
part of the
Wow.
medical team that took care of them. So
Wow,
that was
that's pretty exciting, huh?
It was very exciting.
Wow. What was the name? Is there an institute out there, an orthopedic institute in LA that you trained at?
Yeah, there is. It's called Curl and Jobe Orthopedic Clinic.
Okay.
It's one of the first sports medicine fellowships
Wow.
ever. So, and it's also the place where the Tommy John procedure, which
Right.
is the ulnar collateral ligament reconstruction procedure that a lot of professional pitchers have had to preserve their careers,
Wow.
where that was developed by
It was
Dr.
developed
Jobe.
at that. Wow,
Yeah.
that's really. So you met the Lakers. You get to meet a lot of baseball players. That's pretty cool. That's really neat. So now you're in New York. You're at NYU, right? You're on the faculty of NYU.
Exactly.
Okay, and you have an office in New York, but you also have one here at Jersey City Medical Center.
Exactly, and that's something that I'm really excited about.
Okay.
So I'm a full-time faculty member at NYU,
Right.
and I'm in the Division of Sports Medicine there in the Department of
Okay.
Orthopedics. But I'm also seeing patients in Jersey City, right next to the Jersey City Medical Center at the
In the
medical
medical
office building.
Okay,
Yeah.
great, good.
And I think what's exciting about that is it really allows me to bring a lot of the sort of resources, the intellectual resources of being at a big university like NYU to Jersey City. And I think for patients who live in Hudson County and in New Jersey, that's a phenomenal opportunity.
Sure, they don't have to go into the city anymore. I mean, you're essentially bringing NYU to our campus. You're on the faculty there, and you've got the expertise and the really the clinical knowledge to be able to do whatever they do over there.
Exactly,
here.
and we're doing the exact same surgeries that we're doing at NYU here at Jersey City Medical Center.
Wow.
The exact same complexity. Just the other day, I did a Tailless osteochondral fixation
Okay,
here
so
at Jersey
let's back
City.
up for a minute,
And
because people don't know what you're talking about.
Right.
So tell us
Yeah.
what that is.
Right, so no, exactly. It's the Tailless is one of the bones that forms the ankle joint.
Okay.
And there was a patient that had a big pothole in that bone, in the cartilage, and so the pothole involved both the cartilage and the bone.
Right.
And this is a high-level procedure. I mean, this is a cutting-edge procedure that requires
Not something usually done at a community hospital.
Absolutely
right?
not.
And because we're really the tertiary center in the area, you bring your expertise. We're able to do that at the medical center.
Exactly, and we're able to do that. And I spoke with the patient beforehand, and he asked me, should I come to New York to do this?
Right.
And I told him there really wasn't a need to, because we could do everything that someone might do there here at the medical center.
Now, in addition to obviously doing surgery and looking at sports medicine, you also take call in the emergency department, right? So we have a trauma center, and obviously you get a lot of calls for patients who come to the emergency department for trauma.
Right. So exactly. So I'm part of the trauma rotation of orthopedic surgeons taking call. I think one of the nice things that I bring to the table is an expertise in soft tissue ligament reconstruction.
Okay.
So orthopedic trauma is not just bones.
Right.
You have dislocations, you have ligament tears, tendon tears, and that's something that I have a background in, and that comes from a lot from the sports medicine
there's
world.
a host of doctors that take call for orthopedic trauma. So when we get somebody in who's in a bad accident, they might come in. Would they consult you if it's a ligament problem, because that's kind of your expertise?
Exactly, and I've collaborated with several of the other orthopedic surgeons on staff. For example, recently I did a case with one of my partners, another surgeon who's on the faculty at NYU, but who works at Jersey City Medical Center, Dr. Frank Liparachi.
Right.
And a lot of times we'll do a case that involves, say, both ligaments and bones, and we'll work together, and that really optimizes the care for that patient.
So that's really a team approach, and probably very unique in our area, that no other hospitals don't have that same kind of team approach that we do.
I think so. I mean, just the fact that two, academic orthopedic surgeons
Highly
can
trained,
get together,
right.
can get together in an OR and work together to optimize patient care.
Right.
I think that's really unique, and that's something that I think the medical center promotes, which is great.
Right, and that's something that we really, really want to see, because it raises the level of care for people who, if they're in a trauma, or even if they're not and they need that kind of care, we can provide that, where probably other places struggle to do that. So.
Yeah, no, it's fantastic.
And the fact that you guys are from NYU and have the access to all of that teaching over there and all the expertise over there, that's really spectacular. So there's a couple other doctors in your group, Dr. Capo and Dr. Liberace.
Right.
And you all have offices in the medical office building.
Exactly. We have an office in the medical office building where we see patients.
Okay.
And really, it's exciting. We all do a slightly different thing. Dr. Capo does upper extremity.
Right.
Dr. Liberace does trauma and joint replacement. I do sports medicine.
Right.
So it's very collaborative, even just within our mini
within
group.
your own group.
Yeah.
That's really great. We're going to talk a little bit more about sports medicine, because I know that that's kind of your passion and what you like to do. But I think it's really important that people understand, with your kind of expertise, that great training. I mean, going out to LA and actually just being around the Lakers, that's probably a lot of fun. But obviously you learned an awful lot in how to treat sports injuries during that time in your fellowship.
Yeah, I mean, I think, sports injuries are kind of a unique branch of orthopedic surgery, because you have patients that have very high expectations. It's not just enough to say, we're going to get you back so you can walk.
Right.
It's, we're going to get you back so you can play sports at a high level. If you're a high school athlete, that you're going to be able to try to get a scholarship in college.
Right.
If you're a collegiate athlete, that you're going to, be able to try to make the pros.
Right.
And even if it's not at those high stakes, that you'll just be able to get back to doing the things you love to do. And
so when someone gets a serious sports injury, they come to you. A lot of times you can get them back to really where they were before the injury.
yeah, these days it's getting close to that.
Right.
I mean, obviously it depends on how bad the injury is and on the patient, but our goal is to get people back to the activities they were doing that they're passionate about.
We'll be right back with Dr. Lomas.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org. Jersey City Medical Center, Hudson County's #1 hospital as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Welcome back. We're here with Dr. Lomas. Dr. Lomas heads up our sports medicine program at Jersey City Medical Center. So let's talk about common sports-related injuries. What do you see most of the time?
So one of the most common injuries that I see is an ACL tear.
Okay.
And just for the viewers, the ACL stands for Anterior Cruciate Ligament.
Okay.
So if you look at the knee, there are 4 ligaments, and ligaments are basically just ropes that connect one bone to another. And in this case, the femur, which is the thigh bone, is connected to the tibia or the shin bone by 4 ligaments. One's on the inside, one is here on the outside, and there are 2 in the middle. And those ones that cross in the middle are called the ACL, anterior cruciate ligament, and the PCL, which is in the back here, the posterior cruciate ligament. This ACL, this ligament right here, is often torn playing pivoting sports, soccer, basketball, football, and it's a really debilitating injury. And I think over the last...
So it's the one that's kind of inside
exactly,
that
it's
gets
this
torn.
one right here.
Wow.
And that ligament provides support both for front and back motion of the knee and also rotation of the knee.
Right.
So as you can imagine, if you're playing basketball, a pivoting sport, or football where you have to cut, without that ligament, your knee is going to be completely unstable.
Sure.
Yeah. So I think over the last 5 to 10 years, we've really gotten a lot better at understanding the anatomy of that ligament and how to reconstruct it appropriately.
Okay.
Unfortunately, it's not a ligament that can just be sutured together. You can't stitch it up. You have to replace it with something.
Oh, I see.
And so we either use the patient's own tissue, and so we would use either the middle third of the patellar tendon, which is here, or we would use one of their hamstring tendons.
Oh, I see. So you actually take a piece of that and try to reconstruct it with their own tendon?
Exactly. In some cases, in some older patients, we don't use their tissue. We use cadaver tissue to reconstruct it. But our results, I think, are getting a lot better.
They are.
And certainly now, the patients that I've seen, I think our understanding is at a point now where, for isolated injuries, we can really get people back to what they were doing before.
Really?
To the level they were at before.
So how does somebody know that happens? I mean, they're in a lot of pain?
Typically, the classic presentation is someone is doing a sport, they twist their knee. It's usually the knee is straight, okay, what we say hyperextension, and it's a little bit twisted, and they hear a pop. And very soon after that, the knee swells up tremendously like a balloon.
Okay.
And
usually they present to the emergency room at that point?
Sometimes they will. Sometimes they'll try to walk it off.
Right.
Again, it's a ligament. It's not a bony injury, so they're able to walk it off. But usually then, by a couple of days, because of the swelling, they'll show up to the office.
Okay. All right. And how long does it take is that an inpatient surgery that you do, or?
No, it's an outpatient surgery. So we send patients home the very same day.
Okay.
What's really critical about this injury is to make sure that the muscles around the knee are strengthened and that the swelling is down before you do the reconstruction.
Oh, I see.
So oftentimes we have to wait a couple of weeks for that to happen, and the reason we do that is to prevent stiffness afterwards.
I see.
Because if patients get surgery right away, there is a known risk of developing stiffness after surgery.
And then that defeats the whole purpose of you trying to repair that injury, right?
Exactly.
Now, after you repair it, do people have to worry that could happen again? I mean, do you see repeat offenses, do people coming back with the same injury?
Well, I like to tell my patients that I'm not better than God, which I think is a pretty reasonable statement.
That's a very, very good statement. Right.
So, of course, if it happened once, there is a chance that it could happen again. Likely
is it more likely that you'll have it again, do you think?
There's probably a slightly increased risk.
Okay.
But overall, what we try to do is educate people after they've had the surgery through rehabilitation on how to avoid it.
Okay.
And I think a lot of times people have the initial injury because they've been training for their sport, but they may not have been training properly to avoid an ACL injury.
I see.
And there's a lot of evidence now that what we call prehab or prophylactic rehabilitation, in other words, preventative rehabilitation, can actually prevent ACL injuries. And we've seen that a lot, especially in adolescent girls, where if they do a program of plyometrics and lower extremity strengthening and learning how to land and how to run, they could actually decrease the rate of ACL tears.
Wow. So
I think that's, of course, a very exciting way to approach it, because our goal is really to prevent these things from happening. Right. I love my job, but I would much rather not have to fix ACLs because people aren't getting injured.
Sure. So your approach really is comprehensive. So once you do fix it, it's not just, okay, you're on your own, and hope that you don't get this again. You really work with the patient afterwards to make sure they understand how they got the injury, how to make sure that they strengthen the muscles around that area. So there's a whole comprehensive program, right, that goes with this.
Absolutely, Joe. I think you nailed it. The surgery itself is 50% of it. Sports medicine is all about motion, all about being dynamic, and reconstructing a ligament is just a small part of that. It's getting that rope connected from one bone to the other again. Getting the patient back to sports is really about getting their coordination back, getting their strength back, getting the range of motion back. And that's not going to happen on the day of surgery. That's going to happen over the weeks and months that follow. So I work very closely with all of the physical therapists that my patients go to. I communicate with them on a constant basis and get feedback about how the patients are doing. And that allows me to recommend when they can go to that next step, so they can keep on improving. But that's fundamental, to make sure that is all established before they go back to their sport or activity.
Okay. So that's really, really fascinating. That's certainly one injury that you treat, and it sounds like you're a real expert in that. I would imagine that if I had some type of injury, I'd like to go to you, even if it was fixed, to say, hey, how can I make sure this doesn't happen again? And what kinds of things can I do, what exercises can I do to really strengthen the area around where the injury occurred? That would be... So you have other team members that work with you to do that? So you have physical therapists?
Well, we have, we do have physical therapists. We have some at the medical center. And then we have others in the area that we've vetted, that we know are good, and that we've got a great relationship with. And so, I think the key in any part of medicine, and certainly in sports medicine, is communication between the teams. You can't do everything yourself. A human being is very complex, and as a surgeon, you're really involved in a small portion of that complexity. And I think if you bring everybody and integrate everybody into the whole and communicate, your outcomes are going to be great.
It sounds like we've kind of progressed in medicine to a team approach, and it sounds like you're the epitome of that with any kind of sports injury. So that's really great. Okay, we'll be right back with more from Dr. Lomas.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
welcome back. We're here with Dr. Lomas. We talked about ACLs, but I want to just hit on one thing before we go on to another type of sports injury that you deal with. When you talked about ACLs, you're really an expert in our area in this treatment. Sometimes people have more than one ligament that gets injured, and you can fix somebody who's got multiple ligament injuries. I mean, tell us a little bit about that.
Sure. So, Joe, basically, you know, like we were talking about before, there are 4 ligament complexes that keep the knee together.
Right.
Sometimes people don't just tear one ligament.
Okay.
They'll tear the ACL and the MCL,
Right.
which is this big ligament here,
Right.
or this one here. Or they'll tear the ACL and the posterolateral corner, or the lateral collateral ligament.
Right.
Now, when that happens, fixation becomes exponentially more difficult.
And by fixation, you mean?
Fixing the ligaments.
Oh, fixing the ligament.
It becomes more difficult.
All right.
And the reason is because, number one, those tend to be much higher energy injuries. So for that to happen, it had to be a much more violent force across the knee.
So almost like a really severe trauma or
exactly.
something. Yeah.
And so there's a lot more trauma to the tissues.
Right.
And because there are so many small, delicate structures that need to be repaired or reconstructed, you have to really have a thorough understanding of the anatomy in that area.
Right.
And additionally, there are things that go around. There are nerves and arteries that are very important to preserve. So you really have to understand the anatomy and the function of all those ligaments. So that's something that we're excited.
Yeah. That's amazing. So because of your education and training, you can kind of even do those really complex injuries.
Exactly.
And
we're
you're probably
doing them
unique in the area, right? And we do them at the medical center.
At the medical center.
Wow.
We've done a few already with excellent results. I just saw a patient in the office yesterday. Very happy with his results.
That whole team approach is really phenomenal. So tell us, what other things do you see commonly in your office? What other sports-related injuries do you see?
So another, and this is in the shoulder, but another common injury that I see is shoulder dislocation.
Okay.
Now, the shoulder is like a ball and socket joint.
Okay.
But the socket is very shallow, so it doesn't wrap around the ball. Like, say, for example, at the hip joint.
Right.
What that means is that the ligaments and the tendons around that joint, around the shoulder joint, have a lot of responsibility to keep it in place.
Oh, I see.
What occasionally will happen is, again, during contact sports, football, wrestling, or even if you just fall off your bike or when you're running, that the ball will tear those ligaments or tendons, and the ball will come out of the socket. And so a lot of times these patients will show up to the emergency room because they need to get their shoulder put back in place.
I see.
But even if it is put back in place, oftentimes those ligaments are still torn, or there's a small little chip off of the socket or off of the ball, and that needs to then be treated surgically.
Okay, and so it's almost the same kind of surgery like you were talking about with the knee.
Yeah, so these we manage arthroscopically.
So tell people what that means.
Exactly, yeah. So arthroscopic surgery is putting a small camera in a joint, and through tiny incisions, putting other specialized instruments, instrumentation and tools, and fixing or reconstructing or repairing the structures that are torn and damaged that way. And so
you don't have to cut open their shoulder. You can do little tiny incisions.
Exactly. And what that does is, it first of all, when you cut open the shoulder, you have to essentially damage